So, good day, ladies and gentlemen. Today, we have our own topic, which will be presented by our most senior colleague, and I would like him to introduce himself and also take care of the arena. Thank you.
All right. Good morning, everyone. My name is Nas Abdulaziz Lassis Usman, a Deputy Director, Nursing Services in the State Specialist Hospital, Damaturu State. Today, we are going to look at nurses' involvement in budget. That is approach to nurses' yearly budget proposal in facilities. Viewers or audience will be wondering what is the reason why we are interested in nurses being involved in budget preparation. Now, you are all aware that nurses are the ones that constitute the largest percentage of professionals in the healthcare workforce in any hospital in the country. Secondly, they stay 24 hours with the patients. Thirdly, much is expected from them. Nurses are expected to provide the best of nursing care to all the patients that come for healthcare. They are the ones that they are the custodians of all equipment and hospital consumables. They take care of the patient with the equipment and consumables. They equally control the staff in the wards, e.g. like this nursing staff, the hospital assistants, the wards, securities, personnel, cleaners, and porters, and what have you. Now, they are accountable for equipment and consumables in the wards and units. They have to, navigate to go. They have to cope with all the inadequate resources that is available in their care. So now, it will be an aberration if despite all this situation, nurses are not involved in budget preparation. So the non-inclusion of nurses in budget preparations, like I say, is an aberration, because it's like, despite the above mentioned challenges, if nurses are not involved in the budget preparation, it will be like somebody taking somebody for you are shaving somebody's head when the person is not there. Is that not funny? You are shaving somebody's head when he's not there. So today we are going to look at approach to nurses' yearly budget preparation. So now, what are the objectives? What are the objectives of this presentation? Now, just like I've earlier said, nurses' involvement in budget preparation for their facilities or department have several objectives, which are as follows. 1, it ensures effective resource allocation. Now, the input of nurses can provide invaluable resource needs and priorities to ensure that the budget allocation support high quality patient care. 2, it improves patient care. By advocating for resources that support a patient's care, nurses can help improve health outcome and patient satisfaction. By this, in the yearly health budget preparation, in some hospital, majority of the hospital, it's just like yearly they write the same kind of stuff, the same kind of equipment on the old. It's just like copy and paste from the previous year to the current year. But if nurses are involved in the preparation of the budget, at least they will be able to bring out or mention those equipments that are most needed in the wards or hospital, as the case may be. Now, the third one is it enhances operational efficiency. Cost savings and efficiency improvement in effect promotes transparency and accountability. Now, let us look at the whole system of budget preparation in our health system in Nigeria. In Nigeria health system, nurses face enormous challenges, which includes inadequate resources, limited professional development opportunities, and infrastructure deficiency, which further diminish their professional quality output. Yet, they are expected to provide quality nursing services. Unfortunately, their involvement in policy making and budget preparation is limited. There is need to question why. Now, just like we earlier mentioned, despite all the challenges, much is expected from the kind of care that nurses provide in the hospital. Now, if you visit most of our hospitals, because before embarking on this budget topic, we carry out a kind of research to see how can nurses that are the custodians of all the equipment and consumables, how involved are they in the budget preparation of their facilities? So we discover that they are not, in most hospitals, let me put it that way, in most hospitals, they are not involved in the budget, proposal being presented. So we say, okay, how do we now, involve, how do you now encourage or carry out advocacies for the nurses' involvement in budget preparation? Now, it is one thing for you to lament that you are not involved in something, but it is another thing for you to get yourself prepared. If you keep on, shouting or keep on, lamenting that you are not involved in this, you are not involved in that. First of all, you have to prove to the world or to the society or to the powers that be that you have what it takes for you to be involved in that situation. So now we equally carry out a kind of research on our members, that's on the nurses' understanding of the whole process of budgeting. So we asked so many questions and we discovered that most of the world in charges, yes, they know what is budget. Yes, they know that the hospital have a budget planning meetings. But we discovered that they inform us that they were never involved. So how can this be? So now we say, okay, let us see how we can get our members acquainted with the whole process of budget preparation. Because when we advocate for them to be involved, it is equally good for us to make sure that our members do understand what it takes to be part of budget, proposal. So that is why we decided to embark on this presentation. Now, just why is it that they were not involved in the first place? For instance, despite the crucial role that nurses play in delivering healthcare services and improving outcomes, they are not represented in annual operational health summit in Nigeria. Now, you are all aware that every year there is what is called operational health summit. Despite the fact that nurses constitute the largest number in the healthcare workforce, it will surprise you that nurses, the custodian of this large workforce, the professional workforce in every hospital, they are not involved in the health summit. So the question is why? Yet, day in, day out, a lot is expected from the nurses. But in carrying out certain things, they are never involved. So, understanding some of this issue will help in long way to, making sure that nurses get themselves prepared and push. If you continuously push, definitely it is one thing for you to want to be involved in certain things, but if you keep quiet without advocating for the need for you to be involved in that aspect, nobody will look at you. So it is high time that nurses show to the world that they need to be involved if the healthcare delivery in Nigeria is to be improved, just like any other country, because we keep on mounting global best practices. The question you ask yourself is this: how other countries are carrying out issues? Nurses are involved. Nurses are involved in most of the summit, in most of the preparation for whatever policy that is on health in their country. But here we are very, very much neglected to the background. So it is high time that we need to push for involvement in most of this preparation. So there is it for nurses in Nigeria to deliberately push for involvement in the respective facilities, budget proposals. Nurses should not continue to feel comfortable with improvising most of the basic hospital equipment and consumable. Well, such items could be imputed in the facility budget proposal for purchase. What we mean here is that our nurses in Nigeria, due to shortage of most of the hospital consumables, they have now become very proficient in, improvising. Since they don't have what to use, they just continue to improvise. So it is high time that they push. Instead of improvising, let them push for those materials. Now, how can you improvise an equipment, for instance, PPE apparatus? You discover that in some hospitals, majority of in some hospitals, you discovered, not all, just some few hospitals, maybe those, they are not some very basic equipment such as BP apparatus, monitoring devices, they are not there. So, and you expect that nurses should carry out quality nursing care despite the absence of this type of facilities. So, and you cannot 100% blame the management. Sometimes it is due to the attitude of some of our members. We need to say it out. Some of the ward in-charges and our members, by not reporting some of these damaged items that are very crucial in the management of patients. You have a ward that there's no BP apparatus, yet you see somehow BP of patients being recorded. That is very wrong. If it is faulty or if it has been, damaged, you need to, report immediately to the management that this thing has got damaged, so that it will be provided on time, instead of improvising or falsifying observation charts. So,